Hello, my name is Madeline Dolinar. I'm a Master of Public Health student at Liberty University, and I'm going to be giving you an overview of my practicum experience from this past 2020 spring semester. So my practicum experience took place at the Johns Hopkins Sidney Kimmel Comprehensive Cancer Center in the Division of Hematological Malignancies. I assumed the role of lead clinical research coordinator on a clinical trial that collects and compiles data on older adults who are undergoing blood and marrow transplantation. The collection of data will hopefully be used to eventually identify factors of resiliency that make a patient more or less likely to successfully recover from their transplant. As lead coordinator, I was able to recruit eligible patients coming through the Johns Hopkins Hospital and the Johns Hopkins Cancer Center, enroll them onto the study, and carry out our study-related activities in compliance to the protocol. Study-related activities included data collection through patient-reported outcomes and assessments that were completed by myself, along with data management and compiling. And on to the next slide. So hematologic malignancies are a group of dangerous blood cancers, including Hodgkin lymphoma, non-Hodgkin lymphoma, multiple myeloma, acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myeloid leukemia, and chronic myeloid leukemia. Heme malignancies affect approximately 1.29 million Americans, with half of these cases being diagnosed in people 65 years of age or older. And heme malignancies are considered a public health threat to our older populations, as there is an expected 67% increase in incidence over the next 10 years in this age group. When a patient receives a heme malignancy diagnosis, there's usually a quick turnaround to begin their treatment. Once the patient has received their chemotherapy and radiation, if they're a susceptible candidate, they will usually receive a blood or marrow transplantation. And the blood or marrow part refers to kind of how healthy the patient is themselves and what kind of donor they have will help decide which type of transplant they receive. And so once a diagnosis and treatment plan have been made for the patient, many large research institutions like Johns Hopkins will usually offer the patient some type of clinical trial, and they can either be therapeutic or non-therapeutic. Therapeutic involves the administration of an investigational drug, and we kind of follow that patient through a couple study time points to see how the drug affects them and how they respond to it. Or it can be non-therapeutic, which usually just involves the observation of a patient, no drug administration, and usually the non-therapeutic clinical trials don't directly benefit the patient. It's more so to improve care for patients in the future. And on to the next slide. So for the purpose of my practicum timeline and experience, I will focus specifically on two patients who I personally enrolled and carried out study activities with in a case study format. So patient number one, he was a lively and energetic 63-year-old male with a recent diagnosis of lymphoma. His wife was his primary caregiver, who was very supportive, very involved in his care, and they both were especially interested in being involved in cancer research. Despite the patient's lymphoma diagnosis, he had a medical history of a benign brain cancer diagnosis and minor retinal issues. Neither of these, from my perspective or from his reports, didn't seem to affect his physical health or really his emotional health to any noticeable extent either. And patient number two, he was an equally endearing 71-year-old male with a leukemia diagnosis, and his wife was also his primary caregiver. He had a great amount of support from her and his other family members, but he was noticeably less attentive to his care and his involvement in research activities in comparison to patient one. And patient two, he was a little bit of a more introverted man, a little easily annoyed, and this became rather noticeable upon his research visits. Patient two had an unremarkable medical history, only really consisting of mild arthritis and cataracts. On to the next slide. So data was collected before transplant and 30 days post-transplant through cognitive assessments, which consisted of the RAND 36-item questionnaire and the perceived stress scale, physical assessments, and psychosocial and emotional questionnaires. And this information was then input and managed in an electronic medical database for eventual analysis. And on to the next slide. So for data collection purposes for this practicum, I chose to collect data from baseline and day 30 results from the emotional assessments regarding the patient's feelings of stress levels in regards to their treatment, their feelings of control, and their perceived health. The physical assessments that were evaluated were the patient's feelings of fatigue after walking on a treadmill for about 5 minutes, and the patient's average dominant hand grip strength. And this slide shows the comparison of both of the patients at their baseline for emotional assessments and physical assessment results. And just a side note, the data was scored using a numerical scale, kind of to help create an easy to see and understand charts and easily see any changes from baseline to day 30. And on to the next slide. So at 30 days post-transplant, we see slight changes to the same assessments that were performed at baseline. Patient 1 showed an increase in stress related to his health, had similar feelings of control, a lower perception of health, yet very similar physical assessment results. Patient 2 reported much higher feelings of stress, an almost total loss of control over his health, an even lower perception of health, and showed significant weakened strength. Throughout the process of transplant, there is an expected decline in the patient's physical and emotional assessments due to all of the various and rather harsh treatments that they're going through, and they do spend long days at the hospital almost every day, sometimes every other day, but it's a lot on these patients. So really the goal of the clinical trial is to analyze what predispositions besides the transplant itself might negatively or positively affect the patient's progress throughout transplant. And then the next slide. So it's important to note that there are many factors that we should be considering when determining resiliency in cancer patients. By creating an atmosphere that a patient can recover to the best of their ability, hopefully this will allow future researchers and care providers to see where factors of resiliency are most likely playing into the patient's status along transplant. So in order to improve the patient experience before, during, and after transplant, so that way the patient is given the best chance to recover, some adjustments might include improving education and communication among the patient, their family members, and their medical and research teams. This can help provide the patient comfort, some humility, and a better understanding of their care and their best possible treatment plan. Provide an understanding of the multidisciplinary teams to create fluidity and continuity of care for the cancer patients, and to really ensure all aspects of care are being covered. These aspects can include their therapy teams. A really important one is infectious disease teams, our social work teams, nursing, everything that can really help make the care all-encompassing for the patients so we're not leaving any stone unturned. And lastly, emphasizing the importance of physical activity, healthy eating, and engaging stress-relieving activities to help keep the patient not only healthy, but happy to their best extent throughout their post-transplant phases. And then on the last slide is just some references that were used for this presentation. So this concludes my presentation, and I just want to thank you all for your attention and your time. And I thoroughly enjoyed my practicum experience and everything that I was able to learn from my mentor, the patients that I worked with, and Dr. Law as well. And I already feel so much more prepared to take on my career as a public health professional. I hope you guys all have a great day, and thank you again.